Yep.
Okay, we are rolling. We have speed on now. ILAEA. And all yours, Jim.
Okay.
So,
Sure. So thank you for asking. I'm the chair of the ILAE Dietary Therapy Task Force.
I'm going to start you over. I refrain because you leaned out. Okay, ready? And action, right in Jim's eyes.
Okay. So thank you, Jim. I'm the chair currently of the Task Force for Dietary Therapy for Epilepsy of the Medical Subcommission for the International League Against Epilepsy, which speaks to their interest in the diet, which I think is great. Back about 4 years ago, Emilio Peruca and Patrick Kwan approached me and said that they had a lot of requests internationally from the International League Against Epilepsy, the major task force for the world on helping epilepsy, in increasing their ketogenic diet content. There's a lot of requests, a lot of questions, a lot of from patients all over the world and neurologists to have more resources about the diet. And so we were charged with a 3 to 4 year mission, which is almost complete, of just trying to raise the ILAE's content on the ketogenic diet. And so the website that those of you who are looking at today is sort of a testament to that. It has recipes, books, free articles for download anywhere in the world, all kinds of information, links to different centers all over the world, and we're trying to kind of keep that going and keep that active even after the task force finishes its job. We are really very active in trying to bring the diet not just to the developing world, to US, Europe, parts of Asia, but to areas like Central America, Africa, Southeast Asia, where there's a huge population of epilepsy that is untreated, sadly untreated even with drugs, let alone with dietary therapy. And just try to make it a little bit more of an option for them. There are some very unique barriers they have there in terms of food costs, in terms of neurology availability, very few dietitians in those areas. Yet again, a huge number of children and adults who need help. And so we're really excited about the task force and what we've tried to do to kind of bring the diet to those areas and at least make it more of an option for them.
so where do you see the diet going?
Yeah, so I think part of the biggest barrier that we've perceived, most of us on the task force, in some of those regions is ease and availability. They say, we believe in the diet, we've heard about it. In fact, there's sometimes a lure. They say, oh, it's a Western therapy. It's kind of interesting and somewhat amazing to think of it that way. But they think of it as a popular US, European therapy that they need to have in their country to kind of bring them into the modern times. Yet the concern is, how do they do it? They don't always have dietitians. They sometimes don't have neurologists. And so what we've tried to do as a task force is almost kind of bring the diet down a notch and say, there are ways you can help provide dietary therapy that maybe can use less resources. Could you do things maybe with telemedicine? Could you do with a very good, very smart pediatrician instead of a neurologist who says, I got this and I know where to get help. I can maybe kind of reach out to my colleagues if I have an issue, but I think I can get these children started on the diet. Maybe using some of the alternative diets that don't require the admission or the fasting, like low glycemic index or modified Atkins. That may be more feasible in sub-Saharan Africa than like the classic ketogenic diet. That is sort of where I think we're trying to head, and there's some research, but also just some resources we're trying to build in their cultures, in their languages, to try to show that it can be done and it's not overly complicated. But I think the key is, as I mentioned earlier, for any of these sites, getting help. And so I think if you're someone looking at our website and it's exciting to you and interesting to you and you're in an area of the world that doesn't offer the diet currently, hopefully hearing these videos, looking at our website would say, it can be done, and we're all here to help. All of us on the ILE task force are eager, willing to help. Reach out to us, email us, drop us a phone call. We can try to make it happen.
So this is
Perfect. Yeah.
Yes,
Great.
that's great.
That's what I wanted to give us.
So, sitting at my computer in Santa Monica,
Yeah.
I'm under the illusion that because medications aren't accessible in third world countries or
Yeah.
developing countries, that acceptance of diet might be elevated.
Yeah, it's a great question. There definitely are areas that don't have a lot of medication options. They have maybe 5 or 6 standard drugs, maybe as we call the second or first generation of our anticonvulsants, and they don't have some of the newer drugs, some of the drugs like Keppra, Onfi, Refinamide, which, nothing's perfect, but it's a nice option to have for some of our kids. And the diet, if you have those foods, you could do it. It's, again, the availability, the resources, the startup, so to speak, is really the biggest issue. And how do you get a diet center up and running? But no doubt, there's a lot of interest out there from multiple epilepsy centers all over the world in these developing countries that say, this really may make sense. We cannot get this drug. We cannot get this surgery sometimes. And they say, but diet is something everyone's got to eat. Everyone needs to be on a food, and so could we modify the foods, keep it simple enough for some of these families? That may be a great option for some of these kids. There's some challenges. Nothing is easy in this world, but they're fixable challenges. I think we can make it work.
Okay, and that was actually the next question. What are some of those challenges?
Yeah, so providing the diet to regions of the world that have lots of resource issues and they're in developing areas, there are definitely some challenges. Besides manpower, besides neurologists, dietitians, the foods are expensive. And so when a large proportion of the family's dollar goes towards foods, that becomes a big issue in terms of can they afford dietary therapy. Dairy, meats in a lot of the world are very expensive. And so there again is a perception the diet is a lot of butter and bacon, and we're trying to change that perception and say you can do it with some animal oils and animal fats, but yes, vegetable fats can be incorporated too into the diet, which are less expensive. And you can cook in groups, you can do sort of large portions and then spread it out over the week. Ways to save some money that may be helpful. So that's probably the biggest challenge, is sort of cost and sort of resources that way.
Anything?
That's perfect. That's perfect for our...
There are cultural issues and stuff too.
Yeah, cultural is tricky. Cultural issues are definitely tricky. And so, I think there is no one size fits all. Yeah. And I think, it's for us in the U.S. to say, well, you can get by this, explain it to the families, and have someone in their area, another parent perhaps explain it to them, is somewhat simplistic. It's complicated out there. Kath McGaw from South Africa has been very active in working with sub-Saharan Africa, and she'll talk about village healers and some of the cultural beliefs and religious beliefs that are not just about diet, but about epilepsy. And you first have to overcome that before you even think about what you're going to use to treat them with. So you have to get them on board that this is something we need to treat, this is something that is a medical problem, just to kind of go to the next step of like, what are we going to do about it? And that's Africa, and then you look all over the world, there's so many different beliefs and theories about what causes seizures, and sometimes you have to kind of play to that belief, and so I've sometimes received some emails from certain regions of the world where they say, well, the diet in our country, I think, has a lot of potential because the families see it as sort of an alternative healing treatment that you're helping by using the diet to, fix good humors and take away the bad humors. And I'll say, I don't think that's how the diet works. And they say, we understand, but in our culture, that will work. And I'll say, do it. If that's what works, we don't have the answer for how the diet works, so maybe it is one of the mechanisms. But and that's, I don't know all of those different cultural. That's where we need people on the ground. And that's the other, very important part of this task force. And the mission is to get areas on the ground where they say, this is absolutely not going to work in our region, but this will. Or this aspect of providing the diet, actually people like that. They get that. They get the idea of sort of the high fat, low carb. They're into that, but this part won't work. And so there is no one size fits all. I think we need the local people who are watching and reading this website to really help us.
Cool.
I still recorded that.
Good.
Thank you.
Oh,
Thank
good.
you.
Yeah, no,
That's great.
Excellent. Yeah,
That's great.
Yeah,
Yeah, no, that's great. Mine sort of be longer. For the ILE ones you guys do, short is fine. If you're.
Well, we'll just send you.
I guess some of them.
I assume you're going to
Yeah.
be an editor.